Deputy O'Gorman.
Thanks, Chair. Good morning, everyone, and thanks for your submissions and your speeches this morning. I might start with Alcohol Action Ireland, and the statistics you've presented to us today are really shocking. In particular, I suppose the low number of tests that are taking place annually, 18 per 1,000 compared to other European member states, but also that has fallen, that has decreased over a 15-year period. Could you, from, I suppose, your analysis in terms of working in this area for many years, could you give us your views as to why we're seeing this really significant fall in the number of breath tests taking place on our roads?
I think it does go back to enforcement. It goes back to resources. If the Gardaí if there are not sufficient Gardaí on the roads, there will not be breath testing carried out. I think too, we see that alcohol is very normalised in Ireland. We see that binge drinking is very normalised, and I know that everybody in the medical field knows what an ED is like on a Saturday evening, how much of it is dominated by alcohol. So it's not surprising that that follows through into all sorts of areas. It follows through into enforcement. We know, just again, if we were looking at other areas of alcohol, we have high numbers of underage drinking going on here. We very rarely see prosecutions for sale of alcohol to under-18s. So there's things like that. There's an acceptability about alcohol.
So maybe just if I can follow up on that point, because the level of resources is obviously key, and I think we all accept that, and everyone, government, opposition, share the view that we need more Gardaí on our roads, on our streets, everywhere. But that issue of enforcement goes beyond that, I think, and I suppose. When I read the Crow report there recently in terms of looking specifically at road policing, it was quite alarming in terms of some of the attitudes, and I recognise that is not across the entirety of Garda Síochána. I'm very clear on that. But would you see, is there perhaps is part of the reason for this low number of breath testing, is some of it to do with attitudes to the issue of driving with alcohol, including attitudes among some members of Garda Síochána?
Well, I don't have insight into what the Gardaí are saying other than what is reported. So we're very factual based and we just present the evidence. What I can say is that if you don't publish targets, if you don't say this is what we're going to do, well then there's no drive then to make sure that you will do that. And Gardaí are faced with competing demands on our time. I absolutely understand that, but this is why I go back to, you must have a target, and if you don't have a target, well then why would people go out of their way to do it?
Okay, thanks very much. One of the questions I've asked most of the people who presented to this particular committee is just their views on the Road Safety Authority, and you emphasised the importance for that cross-governmental approach, and I suppose the Road Safety Authority is seen very much essential to that. There was a proposal about 18 months ago stemming from an Indicon report to do a radical restructuring of the Road Safety Authority that was greenlit by the previous government. That's been stopped by the current minister. What's your view on the effectiveness right now of the Road Safety Authority, and would you support the case for significant reform of how it operates?
Well, I think there's really good people working in the RSA, and I think they're working in a difficult environment, because what we're seeing right now is a problem of Garda resources. That's a Department of Justice issue. RSA have no control, as my understanding, about how resources would be deployed, and yet I think that they're seen as being the people who have to carry the can for a decreasing or the problems that we're seeing on our roads. So whatever structure's in place has to have the ability to be able to direct resources. And again, I would go back to this cross-governmental issue. We're seeing the impacts on the health service, but the health service is not having an input into where resources should
Well, look, on that point then, I might put the same question then to the Climate and Health Alliance in terms of the effectiveness of the RSA and whether there's a need for radical reform there.
Yeah, I agree with my colleagues here. They're doing really, really good work, and like everyone brings to the table, is under-resourced. No, I think we need a road safety commissioner. It does not make sense that you have a road safety authority with two arms, one looking after licensing and giving out licences, putting people on the road, and then the other arm supposed to be protecting vulnerable road users, pedestrians, cyclists and everyone else.
They're two completely different
Doesn't make
jobs,
sense.
yeah.
It's a conflict of interest, and that's not working. And we're proving it's not working. Our deaths were 190 last year. There needs to be a road safety commissioner. I work in mental health. We have a minister for mental health. We have a commissioner of mental health, because there's nuances with this type of these complexities. So no, I think we need a road safety commissioner.
Thank you. Dr. Owens spoke about Ireland being overly sedentary as a country at the moment, and the need for us to get moving. And I suppose one area, and it's been touched upon by Deputy Moynihan already, just in the area of the provision of safe cycling infrastructure. Are we building cycle lanes quickly enough in this country?
No. But the case for active travel is being made. If you recall the Daily Mile, they did start in Stirling in Scotland with school children. They had to walk or run for 15 minutes every morning. Their behaviour improved, their cognition improved, their concentration improved. The evidence is there. It's not a mystery. But in this country, 3% of our children cycle to school, and that is the consequence of our infrastructure. My kids live 800 metres from our school, 400 metres to the school. There's a cycle lane. There's no cycling for the next 400 metres. They do not cycle as a consequence.
And what do you see as the barriers to the rollout of that safe cycling infrastructure?
We're very good at saying how many kilometres of cycle lanes we have. We're not very good at saying how many kilometres of linked integrated cycle lanes we have that facilitate your journey from point to point. Yeah. And that's what we need to be focusing on.
Yeah. I don't know, Dr. Clark, did you want to come in on that?
I suppose the Chair mentioned it earlier. There's some really good work being done nationally when it comes to segregated cycle lanes. But as Dr. Legg said, they need to be integrated, they need to be high quality, they need to be accessible and convenient, but they need to be funded. So local authorities are, waving their arms saying we want to do this, but they're not being funded. They're not being funded properly. I do think there's an issue with our kind of dependency veering towards cars. We're the second most car-dependent country in the EU. So there's a piece of work to be done around that. I'm a firm believer in build and they will come. So if you're building something that is accessible and people can use and it's connected, it will be used. So I think sometimes the stats look skewed. 3% of people are cycling. 3% of people are cycling because they're people who are going to take on the roads. I cycle. I have a lovely, and I'm going to use the word greenway because it is a greenway on the Royal Canal from the north side of the city over to the south side. And so that's my commute route. But parts of it are not connected.
Thank you.